On this Friday night, will summer be a bummer or is there hope on the horizon?
We certainly have to be very careful.
Canada's top doctors on whether restrictions should be relaxed as vaccinations and temperatures rise. More innocent lives lost in the Middle East. The amplifying threats and pleas for peace. A Canadian boxer's battle outside the ring.
I want to go to Tokyo.
The decision keeping her from competing at the Olympics that's being called sexist. And not a scaredy cat, the fearless feline fleeing a burning building.
Global National with Donna Friesen. Reporting tonight, Farah Nasser.
Good evening, and thank you for joining us. On a night, there are hopeful signs. The end of the pandemic is inching into sight. Canada's Chief Public Health Officer says this country may have passed the peak of the third wave. The latest weekly average of the national daily case counts is down more than 20% from the peak last month. And Dr. Theresa Tam says more than 50% of adults have now received at least one dose of a vaccine. In fact, vaccinations are ramping up across the country. And Canada's health minister says it's now time to start talking about what a post-vaccinated Canada could look like.
But this is a roadmap for Canadians. This gives Canadians a vision of what it looks like as we proceed down this vaccination path together, what kinds of activities we can anticipate we can enjoy without worrying about either catching COVID or transmitting COVID.
Restrictions will only be reduced if we reach new vaccine targets. Abigail Bimman breaks down the reopening roadmap and what it means for your summer.
Maskless and up close, fully vaccinated Americans can do pretty much anything they want, says the U.S. Centers for Disease Control and Prevention. While in Canada, while we've been waiting months for any guidance, we got this Friday. If 75% of us have one dose and 20% have two, we can hike, camp, picnic, and patio. Probably what you did during last year's no-dose summer.
We're still battling the third wave, right? And so the case counts are high. The healthcare systems in certain parts of the country are still sort of close to the breaking point. So that's why we certainly have to be very careful.
It would be really helpful if that message of one-shot summer was paired with what it actually means for people in their real lives.
The country's biggest city made a decision with a big impact on people's real lives. Toronto is canceling all major summer events.
It wasn't a surprise that they canceled it. We didn't want that to happen.
And we've made it through to effectively Labor Day. And I hope that post-Labor Day will be a whole new world.
For fall, the new guidance shows indoor gatherings, including sports and attending university, are on the table if 3/4 of us are fully vaccinated.
I think mask might be the last layer of that multi-layer protection that we would advise for people to remove.
While the guidelines are extremely non-specific, Canada's top doctor, Theresa Tam, called them aspirational, giving people something to look forward to. She also stressed vaccination rates are only one indicator. Of course, real-time COVID rates in places across the country will inform provinces and territories' own decisions. Abigail Bimman, Global News, Ottawa.
On the vaccine front, though, more doses are on the way and earlier than expected. Next week, Canada is scheduled to receive 4.5 million doses of COVID-19 vaccines from Pfizer and Moderna as provinces continue to ramp up their immunization efforts. 3.4 million doses are going to come from Pfizer and 1.1 million from Moderna. And new preliminary research shows waiting for a second dose of the Pfizer-BioNTech vaccine may offer older people more protection. The British study, which has not been peer-reviewed, looked at 175 people over the age of 80. Half were given their second shot at the 3-week mark. The other half were given it at 12 weeks. Researchers found the antibody responses of those who waited was 3.5 times greater than those who had the final dose within Pfizer's recommended time frame. But antibodies are just one part of the immune system. Vaccines also generate T cells that destroy infected cells. Researchers found T cell responses were weaker when the second dose was delayed. The study's author says more research is needed to understand which vaccine interval is optimal. Alberta hospitals are facing growing pressure as that province continues to grapple with its third wave. There are a record number of patients in intensive care, and while the peak may still be weeks away, as Heather Yourex-West reports, Jason Kenney's government is instead having to focus on internal political unrest.
Inside Edmonton's Grey Nuns Hospital, ICU nurse Andrea Irwin can hardly believe what she's seeing each shift.
It's really shocking, actually, to see so many people so sick. And we're looking after people who don't have COVID, and we're looking after a lot of people who have COVID.
Alberta's ICUs are now seeing a record number of patients, 177 on May 12th, up from the province's second wave peak of 151 back in December. And because the number of new daily infections has been high for weeks, the pressure on hospitals is only set to rise.
The ICU admission number has been around 0.7% of the total. So 7 out of every 1,000. But then what's not factored into that really yet is the impact of variants, which has a higher risk for ICU admission.
But this week, the focus of Alberta's government has been somewhere else entirely. Members of Premier Jason Kenney's caucus spent much of Thursday in an emergency meeting after former caucus chair Todd Loewen publicly called on the Premier to resign. In the end, caucus voted to boot both Loewen and MLA Drew Barnes, another backbencher who has been a vocal opponent of government policies.
I regret that it had to come to this, but I respect the decision our caucus has made, and we're going to move on, focused on the priorities of the public.
The dissension among Kenney's ranks has been simmering for weeks. Last month, 16 caucus members signed a letter decrying the government's COVID restrictions. So removing 2 of the 16 is not likely to make the Premier's problems go away.
It's just postponing the eruption of more dissension, I think, down the road.
Until then, the Premier has more pressing matters at hand as the health system braces for what is likely to be a very difficult month ahead. Heather Yourex-West, Global News, Calgary.
After Alberta, Manitoba has the second highest infection rate in Canada. The province recorded 491 new cases in the past 24 hours. And today, health officials released new modeling showing Manitoba's daily cases are exceeding the extreme scenario. At the peak, modeling shows around 50 new COVID hospitalizations per day by mid to the end of July, and 7 to 8 admissions to the ICU per day by mid-July. The extreme case scenario still sees around 300 new COVID cases a day by the start of September. Today, Manitoba opened vaccinations to children 12 and under. Manitoba's top doctor says approximately 20% of the cases in the province are in school-aged children. The World Health Organization is urging rich countries to reconsider plans to vaccinate children and instead donate COVID-19 shots.
Understand why some countries want to vaccinate their children and adolescents. But right now, I urge them to reconsider and to instead donate vaccines to COVAX.
COVAX is the global initiative to get vaccines to countries in need. A Canadian shipment of medical aid has arrived in India. The containers are filled with around 300 ventilators and thousands of vials of the antiviral drug remdesivir. Today, total infections in India climbed above 24 million. Overburdened hospitals are turning away patients because oxygen tanks and beds are in short supply. The country's healthcare system is paralyzed by the highly transmissible B1617 variant. India's prime minister says his government is on war footing to try to contain it. Another day of intense violence is unfolding in the Middle East. Israeli jets pummeled Gaza with targeted hits on key infrastructure, including a tunnel network used by Hamas. Relentless rocket attacks on Israeli towns were intercepted by the Iron Dome missile defense system. And the death toll is rising on both sides. There are reports at least 122 people in Gaza have died since Monday. That includes 31 children. And in Israel, at least 8 people, including a soldier, have been killed. The Israeli military is building up ground forces on the border with Gaza, suggesting tensions could escalate to a full-blown war. Diplomatic efforts are intensifying too. But as Eric Sorensen reports, the violence is spreading.
A Hamas compound was hit today by Israeli bombs, and Gaza's national production bank was blown up. New setbacks for Hamas militarily. But the attacks are also devastating for the people of Gaza. Buildings turned to rubble and dozens killed, including children. Many families have sought refuge in this UN relief agency school. Artillery was hitting from every side, she said. She had to bring her children to safety. Hamas, too, has demonstrated firepower. Israeli officials say the militants have already fired more than 1,800 rockets. In Sderot, near the border, this building was struck. My home was hit, says this woman. 20 years after the first rocket, the kids are being damaged for life. Both sides have the advantage and disadvantage of proximity. Israel has multiple air bases. Locations in Gaza can be attacked within minutes. But Hamas rockets, while less accurate, can target border towns like Sderot with little warning, and they can reach heavily populated areas, including Tel Aviv and beyond. Then there is Israel's ground forces. They can build up on the border with Gaza quickly. Not far from Sderot, Israeli tanks and troops have been gathering for days, already destroying Hamas tunnels. Their presence an ominous sign that an all-out war is looming. Prime Minister Benjamin Netanyahu said again today that Hamas will pay a heavy price. His political future is at stake. An opposition party has been asked to form a government. A decisive outcome militarily could help Netanyahu politically. But there is instability elsewhere in Israel, unrest in Jerusalem, and mobs of Jewish and Arab Israelis are fighting each other in several cities. It's all putting pressure on the international community to intervene quickly. The UN Security Council meets on Sunday.
The only way that it's going to resolve is through negotiations. There would need to be willingness on both sides to step back.
But at the moment, no one is stepping back. Eric Sorensen, Global News, Toronto.
Nurses are the heart and soul of the healthcare system, but the weight of the pandemic is crushing. Their story coming up. It's more powerful evidence of the toll the pandemic is taking on healthcare workers. They're on the job around the clock to provide care and comfort to those who need it most. But it can be an immense burden, and it doesn't end when their shift is over. During this National Nurses Week, Global News is shining a light on those struggling to protect others and themselves. Here's Ross Lord.
As a nurse, Sarah Walgie has shouldered more than her share of the pandemic.
You're working 60 to 110 hours a week, and I know that's just not myself, it's a bunch of colleagues as well.
In addition to being a public health nurse, Walgie is a psychiatric nurse in Oakville, Ontario. Encountering more patients with urgent mental health crises eventually became too much.
I was having quite a lot of abdominal pain, quite a lot of fatigue as well. You just felt chronically tired, and that's coupled with burnout.
After cutting back on her work week, she felt guilty.
I shouldn't be burnt out this early in my career. I shouldn't be going through this. So then that aspect of guilt weighs in, where it's like, I don't want my colleagues to have to ever go through this.
Especially in a healthcare system that's chronically understaffed nationwide. Before COVID-19, there were signs of improvement. The number of regulated nurses in Canada actually increased by 1.9% between 2018 and 2019 to a total approaching 500,000. But the pandemic is producing troubling stats. In a survey of 2,100 nurses conducted in Ontario in February, almost all respondents reported stress from the pandemic, and at least 13% of registered nurses aged 26 to 35 said they're very likely to leave the profession after the pandemic is over. That's 4 times the normal rate of attrition for that age group.
I get many phone calls at night because I am a representative of our union in our site, and they're crying. The nurses are going home crying.
The Ontario Nurses Association says the province has the lowest nurse-to-patient ratio in Canada. Labour unions say the Ford government's promise to improve healthcare staffing is undercut by other realities, like wage restraints on current employees.
They're limited this year to a 1% wage increase under law. That doesn't apply to police. It doesn't apply to fire. It doesn't apply to paramedics or other essential service workers. It applies to them.
Walgie says some colleagues on the front lines of the pandemic have been overwhelmed to the point of taking their own lives. She's feeling better these days, hoping Canada turns the corner on the pandemic soon, once and for all. Ross Lord, Global News.
Tomorrow in part 2, Ross looks at the spike in students pursuing a career in nursing and whether more action's needed to underscore the crucial role they play.
Why don't we just give free education for healthcare workers, healthcare professionals throughout the country for 4-6 years until we get over this bump?
Still ahead tonight, why Canada could soon see a tsunami of new cancer cases.
You're watching Global National.
The pandemic is taking a major toll on hospital capacity across the country, and that's having a ripple effect on patients not sick with COVID-19. Cancer diagnostic tests and surgeries are being delayed. The fear of catching the virus also has some people postponing or even canceling visits to the doctors. Oncologists fear that that could lead to a huge wave of cancer cases, with many too advanced to even treat. They're warning it's not worth the wait to get screened. It's patients like Diane Van Keulen who have doctors concerned. Diane avoided going to hospital, even though she has cancer, because she was fearful of getting sick with COVID-19.
I refused to go in for 4 weeks, and I got sicker and sicker, and my body became more broken. What would have happened if I went in at the beginning?
Some of Diane's tumors tripled in size. She's now warning others not to wait.
Fear gets you nowhere. If you have the opportunity to get treated that day, don't wait 4 weeks.
During the pandemic, cancer screenings have been missed, surgeries delayed, symptoms ignored by would-be cancer patients. According to the Canadian Institute for Health Information, from March to June of 2020, the number of cancer surgeries were down 20% across the country. Dr. Antoine Escander is a surgical oncologist. He's been collecting data on new diagnoses, oncology surgeries, and screening tests being done during the pandemic. It's been described as there's going to be a tsunami of cancer cases after we get out of this COVID crisis.
I don't disagree with that. I think there will be an uptick of identifying these patients that have not been diagnosed yet. But the question is, are we going to identify them at a point where there's very little we can do? And that's what scares us. I would gladly take a tsunami of patients that needed treatment and sorting out how we would do that over patients who we've missed who now can't get treatment. And we just don't know yet how that's going to pan out.
It's so interesting that you're saying a backlog or a tsunami would be actually a good thing compared to what you think could potentially happen.
Exactly. I would almost welcome a tsunami because I think we would find a way to make it work.
The pandemic has also impacted a 7-year-old boy who couldn't get a stem cell donation because of travel restrictions. How his family saved his life. Saturday on The New Reality at 7 p.m. right here on Global. Boxing the patriarchy. Next, one athlete's battle to prove women don't have to pick between family and career. They say cats have 9 lives. Well, this fearless feline may have lost a few. The black cat you just saw jumped out of the 5th floor window of a burning building in Chicago and somehow landed safely on the grass below, bouncing before running off. Firefighters say the furry friend hid under a car for several minutes and doesn't appear injured. They are now trying to track down its owner. A Canadian boxer is in the biggest fight of her life, but it's outside the ring. Mandy Bujold says she lost her spot on the team competing at the Tokyo Olympics because she chose to have a family. Bujold believes she's the victim of gender bias, and she's launched a legal battle. Here's Mike Drolet on her hurdle ahead.
Twice a day, every day, Mandy Bujold trains with an unwavering focus. The Tokyo Olympics has always been her goal: win a medal for Canada and then retire.
It's that last fight too, right? Like I want to go to Tokyo because I want that to be, the final moment in my career, the end of this chapter in my life.
It's a chapter that's now being written without her because the International Olympic Committee recently decided to use the results from tournaments held in 2018 and 2019 to determine who qualifies. Except Bujold wasn't fighting then. She was pregnant with her daughter, Kate. Her Olympic dream, she learned in an email, was over. Do you feel let down by the Olympic movement?
I do. I honestly do. And it's unfortunate. I think, being an Olympian has always been something I've been super proud of.
Before getting pregnant, she was the #2 fighter in the Americas, as well as a quarterfinalist in the Rio Olympic Games in 2016. She thought the IOC had made a mistake. However, she was told if they made an exception for her, they'd have to make it for everyone.
The argument that this is somehow going to cause unfairness for everyone else, they're going to have to, if they change the rule for this case, the floodgates will open and they'll get all these appeals for rule changes. Well, what floodgates? How many people are getting pregnant?
Bujold isn't alone in her corner. Tennis icon Billie Jean King has expressed support, and the Canadian Olympic Committee and Minister of Heritage have sent letters to the IOC. But will the IOC listen? Earlier this year, the head of the Tokyo Organizing Committee was forced to resign after making sexist comments. In response, the IOC made a point of stressing its commitment to women's issues, urging each competing country to have a male and female flag bearer, and calling Tokyo the first gender-equal Olympic Games.
The legal angle for Mandy is not a fairness issue. It's a human right violation of the Olympic Charter issue because of the pregnancy.
Bujold has filed an appeal with the Court of Arbitration for Sport. In boxing, she's never backed away from a fight. As a mother, it's out of the question.
So I'm trying to be that example for her, to show her, hey, when she looks back on this, later in life and says, wow, like my mom did that, right?
Mike Drolite, Global News, Kitchener, Ontario.
And what an example she is, and a trailblazer. That is Global National for this Friday night. I'm Farah Nasser, and tonight's Your Canada is the sunrise in Montreal. We love seeing your Canada, so please keep sending us your photos to viewers@globalnational.com. Thanks so much for making us part of your evening. Robin Gill will be with you tomorrow. Until next Friday, take care of yourselves and each other.